Welcome to my presentation on the 5 drugs I chose. Hydrazoline is a direct-acting vasodilator. It is useful as an antihypertensive drug because of its ability to directly cause peripheral vasodilation, which results in systemic vascular resistance. Hydrazoline works primarily through arteriolar vasodilation. It is useful to treat hypertension, either alone or with other antihypertensives. Adverse effects include dizziness, headache, anxiety, tachycardia, edema, dyspnea, nausea, vomiting, diarrhea, hepatitis, vitamin B6 deficiency, and rash. Hydrazoline toxicity or overdose produces hypotension, tachycardia, headache, and generalized skin flushing. Treatment is supportive and symptomatic. Hydrazoline can produce additive hypotensive effects when given with antihypertensive drugs. Hydrazoline can be taken orally to treat routine cases of essential hypertension or given intravenously and is useful for patients who cannot tolerate oral therapy. Perform a baseline neurologic assessment with the use of vasodilators with special attention to level of consciousness and cognitive ability. Use vasodilators with caution in older adult patients, as they are more sensitive to the drug's blood pressure lowering effects and may experience more problems with hypotension, dizziness, and syncope. Hydrazoline given by injection may result in reduced blood pressure within 10 to 80 minutes after administration. Never give the drug without adequate monitoring and frequent assessment. Monitor patients for adverse and toxic effects. Have the patient monitor their blood pressure and heart rate and report any adverse effects. Teach the patient about changing positions carefully and slowly is needed to prevent falls. Vasopressin is a pituitary drug. It mimics the action of the antidiuretic hormone ADH, which increases water reabsorption. It concentrates urine, reducing water excretion. Vasopressin is also a vasoconstrictor in larger doses. It can be used in certain hypotensive emergencies such as septic shock. It is also used in advanced cardiac life support guidelines for treatment of pulseless cardiac arrest. It can be used to stop bleeding of esophageal varices as well. Vasopressin is used to prevent polydipsia, polyuria, and dehydration in patients with diabetes caused by deficiency of endogenous ADH. It can be useful in the treatment of gastrointestinal hemorrhage due to its vasoconstrictive properties. Adverse effects include an increased blood pressure, fever, vertigo, headaches, nausea, heartburn, cramps, uterine cramping, nasal irritation and congestion, tremors with sweating. Vasopressin is classified as a pregnancy category Class C drug. It should be used with caution with patients with seizure disorders, asthma, cardiovascular disease, and renal disease. Vasopressin is available as a nasal spray or injection for IM or IV use. Vasopressin nasal is applied topically to nasal membranes and must not be inhaled. Watch the IV site closely for any signs of infiltration. Before administering any pituitary drugs, perform a thorough assessment. Assess the patient's weight and height and vital signs. Closely monitor the diabetic patient for changes in serum glucose levels. Instruct the patient with diabetes to monitor glucose levels carefully and to be alert of high blood pressure, fever, nausea, and abdominal cramping. And make sure they know that it is to be applied topically and not inhaled. Lisinopril is an ACE inhibitor. It converts angiotensin 1 to angiotensin 2. It is a potent vasoconstrictor. Lisinopril prevents sodium and water reabsorption by inhibiting aldosterone, which decreases blood volume and blood return. It is used for treatment of hypertension, heart failure, and acute MI. Adverse effects include hyperkalemia, dry cough, decreased renal function, and although it's rare, angioedema. Lisinopril is available in tablets. Before administering, assess potassium, sodium, and chloride levels, ALT, AST, and BUN levels. Assess apical pulse and respiratory rate. Take blood pressure immediately before doses. Teach the patient it is not to be taken in the second and third trimester of pregnancy. If the drug must be discontinued, weaning is recommended so rebound hypertension doesn't occur. It may take several weeks to see the full therapeutic effects. Instruct the patient to notify a healthcare professional if rash, mouth sores, irregular heartbeat, chest pain, or difficulty breathing occurs. Digoxin is a cardiac glucoside, and it is the only one available in the United States. The effect of digoxin is thought to increase myocardial contractility, also known as a positive inotropic effect. Digoxin augments cholinergic stimulation, which results in increased diastolic filling between heartbeats, secondary to reduced heart rate. Digoxin changes the electrical conduction properties of the heart. It decreases the velocity of the electrical conduction and prolongs the refractory period. Digoxin is primarily used for the treatment of systolic heart failure and AFib, but it can be used adjunct to other drugs of other classes, such as beta blockers, diuretics, ACE inhibitors, and ARBs. The adverse effects are bradycardia or tachycardia, hypotension, headache, fatigue, confusion, convulsions, colored or halo vision, anorexia, nausea, vomiting, and diarrhea. Digoxin has a low therapeutic index, so monitor for toxicity frequently. Signs and symptoms include bradycardia, headache, dizziness, confusion, nausea, and visual changes. Digoxin Immune Fab is the antidote for severe digoxin overdose. It is important to teach patients to report any adverse effects. Inform the patients that certain herbal supplements may interact with digoxin, ginseng, licorice, and St. John's wort to name a few. Instruct the patient to take their radial pulse before each dose. Daily weights are important and need to be done at the same time each day. Digoxin is available in oral and injectable forms. Before administering, assess blood pressure, pulse rate, peripheral pulses, heart and lung sounds. Before giving digoxin, monitor serum electrolyte levels and liver function test. Measure the baseline weight and do a neurological, gastrointestinal, and cardiac assessment. Furosemide is a loop diuretic which can have renal, cardiovascular, or metabolic effects. The hemodynamic effects of loop diuretics are a reduction in both the preload and central venous pressure. These drugs work along the ascending limb of the loop of Henle, blocking chloride and sodium reabsorption. Furosemide is used in management of pulmonary edema and edema associated with heart failure, liver disease, nephrotic syndrome, and ascites. It can also be used in the treatment of hypertension that's caused by heart failure. It is available in oral form as a solution, tablets, and injectable form. Adverse effects include orthostatic hypotension, electrolyte disturbances, arrhythmia multiforme, exfoliative dermatitis, photosensitivity, and in rare cases, aplastic anemia. Assess baseline lung sounds, heart sounds, neurologic status, skin turgor, and a thorough skin assessment. Monitor levels of mucous membranes and capillary refill. Assess vital signs, weights, and intake and output. Assess BUN, creatinine, AST, and LDH levels, along with serum electrolyte levels. Teach patients to monitor daily weights, take in the morning, maintain proper nutritional intake and fluid volume, and encourage patients to change positions slowly and to rise slowly. This is my resources. Sorry about the dog barking and hope it wasn't too painful to listen to.